Month long on Newswatch 12, we're going pink and we're telling the stories of people impacted by breast cancer in our communities. I spoke with Providence's Kristen Filer on some of the risks we should all be aware of. It's a common theme during the month of October: pink wristbands, pink outfits, and even pink coffee. And while some are aware it's a sign for breast cancer awareness, some might not realize the risks women face because of this disease.
Now, men can get breast cancer, but if you're a woman, you're 100 times more likely to get breast cancer. So that's your top risk. Age is also a really big one. 2 out of 3 women who are diagnosed with breast cancer were diagnosed after 55 years old.
1 in 8 women will be diagnosed in their lifetime, and health professionals want you to be aware of your top risks.
Also, having an early period or a late menopause puts you at a higher risk. If you haven't had any kids, that puts you at a higher risk. Alcohol consumption as well will put you at a risk. So 1 drink a day puts you at about 7 to 10% higher risk. 2 to 3 drinks a day will put you at about 20%.
With breast cancer, early detection could save your life.
So that means with early detection, doing a monthly breast self-exam, scheduling your regular clinical breast exam with your provider so that they can do a breast exam, and then scheduling mammograms if you are at the right age.
Doing a monthly breast exam yourself is important when detecting cancer early on, but sometimes we don't always know what we should be looking for.
A lump or a thickening of the breast is really indicative that something could be wrong. And a lot of times it's not just in the breast, it's underneath the arm as well. So it extends back. So this is all can be part of the breast tissue. You also see a change in the texture of the breast. So it's not just a lump in there, it's the skin.
It's best to consult your doctor if you feel any tenderness, bloody or milky discharge, or lumps within breast tissue.
The other thing too is a change in the size or the shape, something that is unexplained. A lot of us have one of the really common things with breasts is that they're different sizes and they're different shapes, but a new onset. So maybe a swelling, especially on one side of the breast, maybe a shrinkage even on one side of the breast. Maybe there's a new onset of different size, so asymmetrical all of a sudden. Like I said, our breasts are asymmetrical, but maybe it's a new onset where one looks larger or smaller than the other.